Hello, everybody. I'm Dhruv Singh, and I'm here to talk about our abstract, which we submitted for the American Pancreatic Association. Uh, the peripheral blood monocytosis at diagnosis is a predictor of decreased survival in pancreatic ductal adenocarcinoma. The study was done at the Mayo Clinic in conjunction with my mentor, Dr. Shaunak Majumdar. So, pancreatic ductal adenocarcinoma, which I'll be referring to as PDAC in the future, slides, is the third leading cause of cancer-related deaths in the United States. The elevated blood monocyte PBM counts are seen in PDAC patients as compared to controls, which we had demonstrated in our prior studies. And the prognostic implication of these elevated PBM counts is currently poorly understood. So the aim of our study was twofold. One was to describe the prevalence of elevated PBM at diagnosis of PDAC and to study the impact of this elevated PBM counts on the prognosis of PDAC. For this, we used the Mayo Clinic Tumor Registry database and included all the patients from January 1st, 2010 to December 31st, 2015. We included only those patients that had an histologically proven diagnosis of PDAC and had treatment-naive monocyte lab values. Also, these patients were excluded if they ever had any solid organ malignancy, any leukemia, or any solid organ transplant in the past. We also assessed the age at diagnosis for these patients, the gender, race, smoking history, and glycemic status. The clinical stage was assessed as per the AGCC-8 criteria, and the treatment status was recorded into surgery, chemotherapy, or radiation. So this slide describes the results of our values. And as you can clearly see from the Cox proportional hazards regression model that we use to assess these patients, the survival was with elevated PBM counts was 4.3 months as opposed to the patients that had a normal PBM count, which was 7.8 months. And this was statistically significant with a p-value of less than 0.0001. These differences in survival also persisted after adjusting for age, sex, and stage, thereby showing that elevated PBM counts at the time of diagnosis are independent predictors of survival. So in conclusion, I would like to say that elevated PBM counts are encountered at PDAC diagnosis, and they are predictors of decreased overall survival in PDAC, which is independent of age, sex, or stage. And this will definitely have future implications in individualizing care and providing tailored targeted therapies for these individuals. Thank you. And you can get back to me if you have any questions on the mentioned email.